Please consult your primary care provider before the start of any exercise program. Please ease out of a pose if you feel any discomfort with the movements provided in the yoga program. Gentle Yoga for Veterans Chronic Pain Series, Part 1. Brought to you by the Center for Integrative Pain Care and the VA Portland Healthcare System. Your certified instructors are Nina Hidalgo and Katrina Rodenkirk. Before we begin, you may want to assemble the following: a mat, chair, thick blankets, or some pillows. Keep in mind that all of the poses can be modified to be done in the seated position. If you have balance issues, practice the poses near a wall for support and safety. The goal is to help you learn to move safely even with chronic pain. This video series has 2 parts. The first part is for daily use, and when you feel ready, move on to part 2, which may have some slightly more challenging postures. As you are performing yoga, remember to gently come out of a pose if you feel any of the following: sharp, burning pain, numbness or tingling, icy or hot sensation in the skin, dizziness, or generally feeling unwell. If you experience any of these symptoms, please feel free to rest, skip, or perhaps try the pose again later. Gentle Yoga for Veterans Chronic Pain Series, Part 1. Welcome to your yoga practice for chronic pain. Let's start with a short breathing practice to start to center our attention and invite a sense of calm into the mind and body. You may start in a seated position, whichever you prefer or feels most comfortable to you today. You may choose to sit in a chair or on the floor, either cross-legged, perhaps with a blanket or a cushion underneath you, or hips on heels if that works for you. However you're seated, try to sit tall with a nice long spine, somewhere between alert and relaxed. The chin slightly tucked, perhaps imagining you have an apple that you're holding under your chin to keep the neck nice and long. And begin to just notice your breath. You may choose to close your eyes or cast them slightly down in front of you with a soft gaze. That will help you turn your focus and attention inwards to be present with your breath to start us off in this practice. Begin to notice the air as it travels in through the nose, through the body, and back out again the way it came. Notice how your body moves to receive breath and how it lets it go. Your mind will take you away from my voice and your breath again and again. That's okay. Your task right now is just to practice bringing your attention back to your breathing. Continuing to breathe, perhaps noticing if your breathing is slowing down as you bring your attention to it. And if you like, you may bring one or both hands to your low belly to help you invite your breath to travel all the way into your low belly as you inhale. So that on an inhale, the low belly inflates like a balloon. And on the exhale, the belly softens and deflates, allowing your belly button to move closer to your body, to the spine. So inhale, the low belly expands to fill with air like a balloon. And exhale, the belly contracts, it deflates. Continuing to breathe at your own rhythm, at your own pace. Just centering your attention on your breath and the invitation for your breath to travel in and out of the low belly. Inhale, it inflates. And exhale, it deflates. Continuing for a few more cycles of your own breath. Just practice noticing what it feels like to breathe in this moment. Using that diaphragm that helps your belly travel into the belly, your breath travel into the belly. And when you're ready, come back to a natural breathing pattern, letting that practice go, and getting ready to start our next pose.